We're back talking about health reform with Alberta's Premier Danielle Smith. Premier, before the break, I alluded to this concept that you've discussed in the past. You campaigned on it many years ago, and it's the notion that a patient, if they can't get timely care in Canada and they do go abroad, that the government would reimburse them up to what the government would have spent to provide that care locally. This is something that happens across the European Union. It's a right there. Like I said, you've raised this in the past. Are we going to see any kind of movement on that policy, even as a pilot project, or maybe something a little bit more full blown? Is that something that we'll see in the near future?
I'd have to consult on that to sort of test the appetite for Albertans. You're right. I mean, it was something that I considered back in 2012 when I was in politics the first time. But I have to tell you, I'm feeling very encouraged about our ability to create excess capacity in our system. And that is my first option, because I don't think from a convenience point of view, Albertans really want to be having to leave their home. They don't want to have to be convalescing in a foreign country. I think they want to get the service here, and I think that's got to be our first priority. So let me tell you the problem in, I believe, every health system in Canada. What has happened is our acute care beds, which should be for emergency, it should be for emergent surgeries, and it should be for scheduled surgeries. There's a certain percentage of our beds that are filled with people who should be in alternative levels of care. In our case, it's those who should be in nursing homes or assisted living, people who are homeless, people who need mental health or addiction treatment. In some cases, we've discovered it's just people who have had a turn in their health and they can't go back to their home because they can't take care of their yard, or they need to have a renovation done in their home. We had one gentleman that we discovered was in hospital for 891 days as a result of having not done his tax return and so not having the money to pay for some other type of care. In total, of our, call it 6,500 beds that are available, about 1,500 at any given time are filled with people who should be in an alternative level of care. So here's our strategy. Let's build proper facilities to house all of those other patients in a proper, more convenient, more comfortable environment, free up those 1,500 beds so that we are able to do the scheduled surgeries and we are able to have efficiently people move through the hospital. That's why we're building also out our chartered surgical centers to give more capacity. And then we're also improving our operating suite so that we can also build out capacity. And because I'm seeing some early success on that, I don't want to give up on that. I want to keep on working that plan. And then hopefully a year from now, we'll be able to tell you that we've been successful and that we're able to help the other provinces take care of their surgical backlogs. That's the vision that I'm asking and challenging our healthcare system to achieve.
So respectfully, health reform, obviously it takes time. This is a big, gigantic system. It can't turn on a dime. What about patients who are struggling today, though, who are in chronic pain? I mean, I'm sure you're more than familiar with some of the stories out there, people that, even walking across their room to get the TV remote can be a huge ordeal because of the serious pain that they're facing. What about those patients that maybe don't have 6 months, a year, 2 years to wait? Is there anything that can be done for them?
We spend in this budget, including capital, $29 billion on healthcare. It would be pretty hard for me to justify spending another billion or $2 billion on medicine outside of our province. People would be asking, why aren't you improving the system here? So I'm going to start that first. And then if there's a need for us to have a broader consultation because they're not able to achieve it, then I'd look at other options. But having seen that we've already whittled down that long waiting list in the space of about 14, it's been about a year and a bit since we've been trying to go down this path. I'm feeling really encouraged because I can tell you we've already had major success in sort of reimagining how to deliver emergency medical services. Before, they used to just park ambulances at an emergency ward. And we said, no, you've got to do drop and go. We've got to have surgical teams that can onboard patients efficiently. And as a result, now gone from a turnaround time where some of those ambulances would be waiting typically up to 4 hours. It's now down to around an hour or less. And then on top of that, we have a number of ambulances that are available. We used to have at any given time in our big cities 1,000 minutes where we never had ambulances available. We're down to 1 minute. So I don't want to give up yet. I think we're making some good progress, and I think you're going to see more.
We've only got about 25 seconds, but very quickly, are you expecting or seeing any chance of reform at the federal level to give provinces more flexibility?
Look, we signed an historic healthcare deal. They've given us and partnered with us on a 10-year plan. Plus, we managed to get some bilateral deals in 4 areas. So as long as they let us experiment, I think we're going to make some great improvements.
Okay, well, listen, Premier, thank you so much for taking a few minutes to chat today about health reform.
My pleasure.